Hi, everybody, and welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, and I'm absolutely delighted to be joined again by the beautiful Dr. Robin Rose, coming all the way from Molokai in Hawaii. Now, we have done some pre-testing, and she's got a bit of a dodgy internet connection, so we're going to do our best, and hopefully you'll be able to hear, and I will pause it if it drops out too much. But if you haven't come across the beautiful Dr. Robin Rose, we did a podcast a while ago where she dived into her own story around how she's worked with reversing her own chronic kidney disease. But Dr. Robin Rose is such a pioneer and quite an inspiration in this space because she's so curious and just keeps digging and taking and furthering herself on her journey. She actually started doing yoga back in 1965, am I allowed to say that, Robert? And traveled to India and then into Europe. And she lived in this little medical village and actually worked with the local doctors there. So really been immersed around traditional herbalism. Then when she returned to America, she lived in a community and really honed in her skills of farming and nutrition. And then she started her academic journey. So first it was a RN practitioner, then a pediatric nurse practitioner. Then she completed a family nurse practitioner master's program and just decided that was all completely inadequate to perform the role of primary care clinician. So she headed off to medical school to get her medicine degree. And she was so blessed to be schooled and mentored by Andrew Weil, MD, who's the grandfather of a lot of holistic medicine, and it was on the board of the medical school. And she was just exposed to some amazing healers that also worked via the non-conventional path. So she's really trodden that soil herself. She then went to Sri Lanka and for an extended period of time to study acupuncture, and she worked in a large clinic in Colombo, then moved into family medicine residency, and then just continued her journey down nutritional medicine, homeopathy. And then in the past 11 years, she's really evolved a new specialty called rhenology, which she's going to talk about, which is the art and clinical science of kidney success. Dr. Robin Rose has a real focus on, and I agree with her here, that really as soon as you move into stage 2 kidney disease, we need to start treating it there, not waiting till stages 4 and 5, which is where often patients turn up. Her passion's been inspired by the Russian bioregulator doctor and her tutor, Dr. Trothim. I'll let you pronounce that one, Rose, Dr. Rose. And she is the physician and wife of researcher Dr. Cavitson, who was the guy that really pioneered the tools when it comes to bioregulator. So Dr. Robin Rose, welcome back to the Kidney Coach podcast. Thank you so much for joining me. And I can't wait to dive into the amazing topic that we're going to continue from my conversation with Dr. Grimberg, which is menopause hormones and chronic kidney disease.
Indeed. Well, I've done an amazing deep dive into kidney disease and into peptides and especially bioregulators. And with this topic, it just opened yet another folder for me, which is the awareness that there are, well, I'll just say it this way, the kidney bone is connected to the head bone, to the heart bone, to the foot bone, to the ovary. And so as women are aging, menopause is inevitable. They say kidney disease is inevitable as well, but I'm not in agreement about that. I think there are reasons that as we age, kidney function can decline. But half of us with CKD are women and are menopausal. And I call it the kidney demic. And because none of the statistics really talk about stage 2, I started having my own thoughts of like, what are you waiting for? And indeed, when you start looking at what's happening in stage 2, part of why it's not considered to be CKD is because, we don't have any pharmaceuticals for it. So, it's normal until we do. And I'm in profound disagreement with that, because I've always, like a naturopath, and it was Andrew Weil who talked me out of becoming an ND, and I went to med school, sometimes with regret, but I was able to learn all of this stuff, that lifestyle matters. I mean, I work with people who have, all of a sudden their GFR dropped from 110 to 80. And then we start looking and go, well, there's dietary changes, there's sleep changes. You're not drinking enough. You're drinking the wrong thing. Blah, 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 blah. Stress, toxins, all of those things is medicine. And so we're also finding things like vascular changes. One of the things that people die from quote kidney disease isn't kidney, but cardiovascular. And the connection is, the heart bone and the kidney bone are almost the same bone, two ends of it. So endothelial damage is happening very early, and we have a lot of tools for that. Interestingly, menopause, even with normal kidney function, is doing the same thing. And so, mitochondrial changes are happening early. We don't have laboratory studies for tubular issues, really. I mean, there are some, you can't get them, you can't find them. And so it's just interesting to realize you got to be a real healer and intuitive and listen to early symptoms, because then you can say, oh, we need some mitochondrial support. And now we've been having this fabulous conversation about Klotho, which has been on my get to it list for a while. And one of the things that I don't hear loudly enough is the issue of phosphorus. I mean, I was actually ridiculed in a study group nephrologist for saying that it's important to know about phosphorus in stage 2. And I still not only believe it, but even more so. And Klotho was involved in that. I mean, we have Klotho, FGF23, a lab to keep in mind. Vitamin D, you got to know what that is. Calcium, you got to know. And phosphorus, you can control with diet to a large extent. But also, there's that parathyroid is another part of this. And we have Bonotherc, a bioregulator, which I think is very appropriate for kidney because of this. And funny thing, menopause also impacts parathyroid.
So walk me through that. Because you and I are both fascinated with, I'm right into the Klotho, FGF23, phosphorus, and vitamin D. I think the cascade of chronic kidney disease, I actually think a simple vitamin D deficiency that leads into dysregulation of the FGF23 phosphorus Klotho pathway is happening well before we ever see changes in EGFR. I think that's one of the fundamental pathways that then everything that you just said, like we're so on the same page. So walk me through why menopause triggers or is related to a drop in Klotho, because I don't know that connection, and that is fascinating to me, so I can put that together.
Well, one of the things you have to realize is hormones talk to each other. They're not isolated. Our circulation is that important. And so we're also, seeing parathyroid effects with menopause. And, there's calcium and phosphorus dysregulation in the bones. It's like these things are happening in different places. The brain's changing. That has something to do with parathyroid as well, and so it really, there are pathways that just overlap. And one thing that I always like to say, I just was editing this part of my book that is close to coming. The lab for phosphorus, which is not done hardly ever. I get labs from people and I'm like, there's no phosphorus. It's ridiculous. Anyway, until a peeve of mine. But what I learned early on, and why am I interested, is because my phosphorus has been elevated for a long time. I had gut issues because the surgeon that removed my kidney damaged my distal bowel. So I think whole history. Well, people don't get high phosphorus in stage 3. Okay, but I have it. So can we talk? No, not really. So, it's like I like to remind people that if those things irritate you, it may be for a real reason. Just saying, isn't it?
Mm.
So the lab, the phosphorus lab, mid-range is what's safe for kidney disease. If it's over 3.5, it's already inducing cardiovascular changes. And that's really huge because we know that menopause is inducing cardiovascular changes. We know that nitric oxide is a huge player. And I'm just now kind of understanding and learning how all these things play together. How FGF23 messes with Klotho in the kidney and, vitamin D. When I was in Oregon, I mean, everybody I tested was low.
Mm.
Now I'm in Hawaii and I see people have pretty good levels. So it's like, okay, one factor, and you have to get each person. There is no protocol. There's only personalized care, and it's like a collage that you get different presentations of in each person. So, potassium was an issue for me. I'm giving potassium to some people who they have low potassium with kidney disease. I'm like,
Yeah,
boy, am I
exactly.
jealous.
Yeah,
Yeah,
it's so fascinating. What an interesting connection, because like I was saying before we hit record, a lot of my women in my mastery group said, chronic kidney disease, unknown cause, happened at menopause. What's the connection? And I was like, but this is so brilliant because it's so much more refined. So tell me more. So we sort of know about the connection between hormone changes, parathyroid, and how that's going to move there. And, I know you're really big on making sure that we look at kidney disease when it becomes stage 2. Is there anything more you want to say that before I sort of move you on to the role of senescence and chronic kidney disease and just that whole aging thing? And we'll jump into some bioregulators because you've mentioned one bioregulator now. I know that. But, I
yes,
sort of want to just circle back around because I do love that you're so on point with this about stage 2. So maybe just talk to that for a moment and we'll go on, because I reckon if we tested menopausal women, we would see more in stage 2 if that became a regular part of the hormone menopausing test. Is sort of what I'm thinking as you're talking.
I love that. Yeah, absolutely. I mean, it's interesting because motivation is the beginning of taking care of CKD. Self-love. I mean, I can relate. I sat here at my table and cried when I couldn't eat a bowl of beets. I wasn't crying over sugar and ice cream. I was crying over avocados and bananas and papayas. I moved to Hawaii. I can't eat any. My potassium was, my nervous system was reacting. All right, then I finally figured out to alkalinize. That's a big one. So in stage 2, I mean, I see CO2s of like 20 on people's panels. That's a marker for bicarbonate, which alkalinizes, and that's a huge issue with kidney disease, and it's so easy to fix. I mean, I've seen people normalize like 8 different markers that were worrisome if they proceeded. They've been to their neighborhood allopaths who don't even bother to tell them that. It's like, so I have a cool story. I went to, when I hadn't started taking this and I'm struggling with all these abnormal things, I went to our local thrift store, and lo and behold, brand new bottle of bicarb tablets, really cheap, unopened, all up to date. I said, I think the universe is telling me to alkalinize better, even though my diet is basically vegan, more or less, and it still doesn't matter, So you start seeing this acidification that happens in the body. And I mean, I learned about, get back to basics before I thought about kidney so poignantly. And many people are too acidic from the environment, from emotions, stress. Diet is huge, animal food and grains can acidify. So you've got to find a balance for that. And with kidney disease, it's way worse.
Yeah.
So that's something. And it's like, you got to exercise, you got to keep your muscles. You got to build that. You got to do stress reduction. Kidney disease and menopause alter the nervous system and the adrenals in ways that put an excess of stress hormones. And there are techniques. Everybody in Hawaii goes to Las Vegas. I'm like, go to Vegas, as in your vagal nerve, find that place. Be absolutely part of your daily vitamin. It's breathing and chanting and communing with nature and all of those things that sound like fads are absolute medicine for both kidney and menopause. So it's the willingness part is start being self-explorative. What am I doing that I can change? I don't want to. Okay, but you're an adult. Make a choice. What do you choose? And that's a lot of my conversation for people in stage 2. And I mean, there's tons of science behind it. All you have to do is start looking at, at vagal nerve and kidney, and then go for the gut. You always start with the gut. I mean, dysbiosis is a known cause of kidney disease. The other thing is go for heavy metals and don't eat glyphosate. I don't know what it's like in Australia, but it's crazy. It's in everything, and they're adding other chemicals, and it's like,
yeah, it's not as
reading
bad.
labels, being sort of OCD. Yeah, and all those things are stage 2 things you can do. And again, it's loving. It's loving to yourself.
Yeah. And do you think more people would do that if there was more education around the fact that, because here's the thing, people don't know about kidney disease. That most primary care physicians, they see an EGFR of 71, don't flag the patient. So the patient doesn't know. They don't know what they're looking at, right? Do you think if there was more education around the fact that, your EGFRs drop from like 100 down to 71 quickly, right as you've gone through menopause, and while you're not in the zone of where we know what to do, I mean, it's so simple, right? If there was better education and go, look, if you don't look after yourself, you're going to end up with kidney disease, which will increase your risk, as you mentioned right at the beginning, cardiovascular events. And here's some, like you say, so simple. Let's just alkalize you, get you out into nature, vagal nerve stimulation, all the things that I'm also totally on board with, like humming, singing, breathing technique, like 3 things that you could do that won't only just help your kidneys, but you'll feel just better in yourself. Like, is it just that piece that most primary care physicians are like, well, there's nothing we can do, we'll just sit, it's a sit and wait game? Like, is it that? Do we just need to better flag? Like, how do we do this, Robin? Like, ow.
Like to know. I mean, I've been asking this question for decades, having started, how are we going to do this? And I learned more about patient education and making the time for it in nursing. And as a physician, the potency, before I finished residency, my last name was Power, so I got to be Dr. Power.
Well, I didn't know that.
I was like, Flower, so I went for the old name. But it's time. And at this point, I'm doing more physician education.
Yeah, so you were just talking about all the sorry, like I say, the internet's a bit dodgy, but you're talking about all the beautiful things that people were doing while they were waiting to see you, because you were really focused on patient care, which means you can't fit that in the traditional 10-minute model. You can't. So same with me. Like I don't do a consult in under an hour these days, just because I won't necessarily talk about and do and educate. Like, how can I do it in under that?
And so I think it's a koan. I don't have the answer. I've been trying my best to reach out to the American Kidney Society, and it's like, how are we going to do this? I think that it would be really cool to have like Dean Ornish programs for people with CKD 2-3.
Yeah, I agree.
That would be a fabulous. Somebody should do that as a business, but I think it really does need physicians as the mouthpiece, and then other associates to support that, because kidney is so complicated, and there's something powerful about the physician telling you your diet is medicine. You need to do this. This is part of our regimen.
Yeah, no, I agree. Yes, so do you want to do bioregulators or senescence? What's easier to talk about first and connect it into menopause and CKD?
Here's a little dance. Is bioregulators are so small, they don't need receptors. They can just have like little escorts, transporters. They get in the cell, they get in the nucleus, and they lodge in the DNA. They can't change what you were born with. If you inherit something, you inherited it. But life damages genetics, and these little actors can actually repair epigenetic damage and bring it back to factory settings. It's not like, oh, I take a pill and I'm all fixed, but just that on your limbic system is key. In other words, I can toxins, the heavy metals, the stresses, the infections, the traumas. And so careful placement in each personal story, bioregulators to put on top of your beautiful naturopathic functional integrative plan that you've come up with.
Yeah, I'm a big fan of bioregulators, and it was
froze.
Yeah, no, we're good. I can hear you now. You froze momentarily. I was just saying I'm a huge fan of bioregulators, and it was, a lot to do with you and Natalie Ninham that led me down that sort of rack. So I feel like they're completely underutilized and so powerful. So you very eloquently spoke about how they work and the restoring to factory settings, which is such a perfect way of talking about it. For people that haven't watched maybe other podcasts with Dr. Camp and those sort of things, just dive in, because I know people want to know more. Dive into more of what are bioregulators, the history of them, and then let's go down the route of which ones you really think are beneficial in CKD, and specifically menopausal induced CKD.
Well, apparently, Professor Vladimir Havinson was in the Soviet military and was ordered to investigate and discover substances to protect their military from American military, chemical and radioactive warfare. That's intimidating just to think about. And he did. He's a gerontologist by training. And so he proceeded along once he wasn't in the military, but with Soviet funding, unbelievable over the decades research, which I've been spending the last several years correlating into this project that you're going to love this book. It's so fun. And so basically their research, lots of rodent studies, people complain about that, but I heard Professor Robinson, who sadly passed away in the last year, which is very tragic. But the work is continuing, and his wife is a physician and did a lot of research as well. And she's coming back into after all the distress of that. But anyway, I heard him say they've seen 1 million patients in their clinic.
Wow.
You know, so these things have been tested and used, but you know, nobody's done what I have, which is put all these together for something specific as CKD.
Mhm.
Which when I started reading about this, I'm like, oh my, because if you think about it, and that's what the idea of my book is every single thing that you can come up with. I've been doing whatever it is, brain CKD, you know, Alzheimer's CKD, blah, 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 everything, every herb, every supplement, everything that I could do for years now. And CKD, and the amount of research is insanely huge. And there's also quite a bit of cogent research that allowed me to have a little bit of chutzpah to say, we can put together a protocol for people who are ready, willing, working with somebody to really repair a lot of the damage, and then cherry on top to really recover some pathways that just can't quite make it. And I mean, some of it's just so simple. And you mentioned senescence. I mean, bioregulators are senolytics. They do address the molecules of senescence. And so I don't think they're mutually exclusive.
Sorry, again, that internet connection, but you're just saying that bioregulators are senolytics to a degree, and they're not mutually exclusive. So walk me through that, because I actually didn't, I mean, it makes sense to me, but how do bioregulators work on senescent cells? Is that just by, like you say, the factory resetting sort of thing that it can do, is mopping up epigenetic?
The epigenetic producing the proteins that you need with bioregulators is they help our innate healing systems go back to doing what they're supposed to when they're broken. And so senescence, the cells are getting older, or, you know, this is a protection against cancer. If a cell is a little bit funky, it'll stop functioning. I mean, they call them zombie cells. They'll just like stop, and they're eating and they're taking up space, but they're not doing anything. And so, you know, in time, those cells actually start spitting out inflammatory cytokines, and they infect the neighbor cells. So you have a whole regional inflammation, oxidative damage, which is CKD, which is most chronic diseases, and certainly is amped even more with menopause.
Right.
You know, and so, you know, that's just a lovely thing. Hormesis is another concept that I've learned since I dove into peptides, which is just a sexy idea that a little bit of something, so a little bit of stress, keeps our systems vital. Too much, break. So it's like, where's that sweet spot? So I have this idea, like, where's the hormesis? You know, and there are very few things that there isn't. Lead, no hormetic amount.
Yeah, right.
None of it's safe. But otherwise, even the other heavy metals, a little bit, can actually trigger the immune system. And, you know, that's where, like, the antibiotics in the food supply, and we're killing off all these bugs. And meanwhile, you know, some of those bugs are actually hormetic assistants to our immune systems working better. So we see more chronic illnesses. Okay, less where's the balance? You know, it's constantly looking for the balance. So, and one of the articles I saw recently said there's 100 different kinds of cell types in kidney.
Yeah.
That's
seen that article.
an enormous diet.
Yeah.
And so, okay, you know, that's, you have all these different approaches, you know, and I'm going to pull up my list, because I made a list of bioregulators, and
That's
why.
good.
I could rattle off a little bit.
Well, that's what I was going to ask you, you know, like, for people listening, and a lot of my a lot of our audience now have been exposed to bioregulators, definitely peptides. If you are talking CKD related to menopause, what are some of the bioregulators that you would, and again, it's hard because like you mentioned before, and I want to rephrase this before people go jumping.
That I love, everybody is carnosine.
Individual.
I love carnosine. I am like a carnosine freak. It's a
Carnosine. All right. Before you cut out, you were starting, you're a carnosine freak. And I know you are, because I also love carnosine. So tell us all about carnosine, because it's not a bioregulator, or it's not a supplement that people would even recognize as a bioregulator.
I gotta get the screaming dog to get out of my takes their job, but come on. It is basically fancy beta alanine. When it's bonded to histidine, you have a very different reaction. The body actually has receptors inside for di and tri peptides that don't work with single amino acids. So you get a whole other thing. Those two amino acids are part of big, huge peptide proteins. I mean, and so they're the ones sticking out that might work. But supplementing it, especially as we're telling people with kidney disease to eat more plant-based food, carnosine, like carnitine, can be sourced from meat and animals. So, that's an issue. Carnosine does so many things. I have 40 pages of it just in the Materia Medica in my book, only about kidney. I mean, it's all you can get lost in for years, I think. And it's over the counter. I haven't found any evidence that people shouldn't take it, so I think it's pretty safe. I mean, the next one on my list is epitalin or endolutin. Those are amazing for menopause. In fact, if the thing that we didn't say is early menopause makes for a shorter lifespan. And so
fascinating.
Early does as well. But so here we have these pineal peptides that are known to delay aging of oocytes, of the eggs. And it has an action on the mitochondria and blah, 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 blah. I've had people go, oh my God, I started my period again. Is this supposed to happen? It's like, yeah,
Oh.
Sorry, but think about your bones and your blood vessels and your eyes. And that was the one I didn't put. I'm going to add to this little document is eyes change as well. But the thing to know is melatonin has a place in menopause, and it has a huge place in CKD, and epitalin and or endolutin. They're just different formulations, but similarly available and from the pineal, which, I mean, I don't know if, did you learn about things about pineal in your naturopathic education?
Only in,
I don't remember.
Dr. Joe and with the people that are doing quantum physics, different stuff. Otherwise, we never learn about the connection between the pineal gland and regulation. It's not talked about. Nobody.
I mean, both of those, it's crazy. It's like, here we are with whole organ systems that is like a frontier. And, these things improve. I mean, the particular pineals helps with hormones, which helps with blood pressure, contributes to sleep optimization, and melatonin helps the immune system, and so it's a win-win. Next on my list, I'm just going to these because I have a bunch of them. Pinealon is from the brain, and that actually has a role with homocysteine, another nasty molecule that kidney disease amps up, and amped up homocysteine is a danger to blood vessels. So here we have another option. contributing option. It's not the only one. This isn't allopathic medicine. It's like, a weaving of all of these things together. And so again, the brain kidney ovary connection is enormous. And that could be a whole conversation that we have, but keep that in mind. Of course, the next one is liver. Ovogen, we know that the liver is affected and hormones traveling through the liver get altered. And so early on, just optimizing these glands, these organs that have huge jobs to do. And if they're diminishing and you just boost them up, and then be willing, like, okay, if somebody has a little dip with liver function, don't do stupid stuff that makes your liver more sick. None of us are perfect, but it's like, try harder, because I had a gun to my head. I mean, my kidney stuff started with cancer. And so I didn't doubt, I was getting death threats of, you have 5 years, it's like, forget this, I'm going for it. Next is ovary. There's an ovary bioregulator, which absolutely makes sense to use. One have ovaries, though. This does the cool thing about bioregulators is, and Robinson and his team figured this out. If you take an eye bioregulator, it's not going to go to your heart. They were able to do tracers, and so you have to have ovaries for the ovary to work. The next one is Vilon, which is another 2 amino acid, this time thymic bioregulator that I utterly adore. It does everything. The thymus gets dinged by both kidney disease and menopause, and that means immune system dysfunction. T cells aren't working, natural killer cells aren't and to balance that, to help with making the proteins you need. Molecules that get damaged seem to have benefits. I mean, there's a ton of it. And here, immunosenescence and inflammaging, I love these words, are affected by Vilon. And immunosenescence basically is what we were talking about, cells just stopping, like they're like frozen. The next one is goat bricks. I love the names of these. It's like, I want to go to St. Petersburg and see what they're one of these days. Gotatrix is muscle. Kidney, you lose muscle. Menopause, you lose muscle. Both of them, you lose muscle and gain fat. Nobody needs that. Muscle is bank, as we say these days. And so this particular bioregulator gives us a benefit to not only muscle maintenance, mass, strength, bone density is also benefited from this. And so, people might see the term sarcopenia, which is muscle shrinking away. I mean, it's very intimidating. It's scary. I only weighed 82 pounds at a point, and I took it seriously with my garden and carrying rocks and logs. And it's like, okay, I'm still working on it. But muscle is important. And so is bone marrow. And so Marlow, the next one, it's a bone marrow bioregulator. That means they've carefully looked at the animals. They've ruled out all those funky little infections that people are worried about from cows. From what I've read, it could all be not true, but it sure seems like they've taken that very seriously.
Yeah.
And so, I'm comfortable taking animal-based bioregulators. There are synthetics. There are 2 different classes, the natural and the synthetics, and they're a little bit different. And I think a clinician needs to kind of guide how that's used. But, taking this seriously. And I mean, there's all kinds of elaborate chemistry we can talk about, but, to me, it's more interesting to see the bigger picture and understand I'm dealing with all of these things. I'm juggling constantly. And you cycle these things. So
Yeah.
it's not like you're taking it for years at a time. And then pineal again. Bonotherc, I love this word, is parathyroid. And I love it because it does help with parathyroid, calcium, phosphorus, FGF23, D, and Klotho. It's like, wow, why wouldn't somebody with CKD, especially early before anything is even showing up, do a month of this and then 10 days every few months? Same with adrenal. We know that any kind of chronic changes triggers the body to worry, like, what's going on? That's that sympathetic nervous system thing happening, because at a cellular level, it's like alarm system, something's up. The cell danger response, I think, reacts like, where's the fire? And
Yeah.
sometimes I've noticed that I'm like, what I tell the dog, chill, there's nothing going on. Stop barking. That's my
Yeah.
nervous system right there that went up. Thyroid again, all the glands are affected, and thyroid in CKD is known. I mean, the T3 gets lowered, and the transformation from T4, which is inactive, to the active is compromised, as it does with menopause. And I mean, I found most of my menopause patients needed thyroid. And funny thing, a lot of the symptoms of CKD, which we don't have symptoms, I don't even agree with. They're just vague symptoms, but that's not to say they're not kidney symptoms. We just, Next, vent fort. Vent fort is blood vessels, and blood vessels is CKD. I mean, it's a
It's my
huge
go-to.
thing.
It's the first one I use in CKD is Ventfort. It's number one. Yeah.
It's huge, and there's absolutely no reason not to do it. It's like, that's the thing. It's like, I love these. There are no side effects. They're not contraindicated with other medications, and they even work better when bundled together.
Yep.
Urinary bladder
Yep.
with menopause, no, and with kidney, definitely. I'm just going to rush through the last of these. Cartilax is cartilage. It's huge. I mean, this is one that does modulate senescence, specifically for kidney. And we know that I spent so much time looking at papers that I found stuff that was, even in Russian, I used the translator. So I take like a paragraph at a time and translate it.
Yeah, right.
Arthritis happens with menopause. And so, that's a whole nother issue. Pancreas, obviously, diabetes happens in both of these conditions. Diabetes is enormous with kidney disease, and kidney actually messes up insulin resistance, and a lot of the bioregulators go right for that.
Yeah.
But pancreas for sure. And my favorite, pilotax. I have profound gratitude for the kidney polypeptide complex of pilotax. And personally, I'm somewhat unwilling to stop it. And I've taken it for long periods of time, asked the Greek physician expert, Marios Kyriazis, about it. And he said, well, as long as you don't have side effects, there's no reason not to.
Yeah.
And I every now and then I'm willing to stop for 10 days. I love it. I find that it's an incredible just balancer. I couldn't tell you what pathways are being repaired. And one of the nephrologists that I was speaking to said, well, which part of the kidney is it from? I think it's just renal parenchyma that they grind up and purify and do whatever they do, which I am absolutely clueless. I'm not that kind of a chemist. But, I'm pretty much telling anybody now, it's like, just add this. and listen. It's like I personally listen to when I need stuff. And I'll go and go, oh, I'm really feeling like I need adrenal bioregulator. And so you can do them I do 3 at a time for 10 days at a time.
So, yeah, that's
and I'll just cycle.
Yeah. I love them. And they're so instant, right? Yeah, especially when I put the pineal gland one in, my sleep within a day completely, like my deep sleep suddenly goes right up through the charts. Like they're just, like you say, no side effects. They're just hitting and upregulating gene expression, and they're just such a beautiful, simple thing to use.
Okay. Yeah, I am excited to have finally found a formatter. I mean, this book that I'm working on is quite a tome. It's like actually become bigger than I ever thought it would be. And it's so inadequate even with what all is possible. And yet just to understand how these things work, understand what kidney disease is doing. And then I love this. It's like even more specific is what kidney and menopause, and you and I could write an encyclopedia together about all of these things because, I mean, the science is exotic. Listening to Dr. Greenberg, I'm like, I am not that articulate as a scientist, but I am as a clinician. And there's a certain listen we do, and there's a certain synergy of putting all these things together, especially primary care, because people walk in, it's not like you package them up and send them to the specialist who only looks at that one thing and then they come back. This is like everything matters and everything impacts that one thing. And so, I'm a big proponent of excellence in primary care, and kidney's an example. It's like we've got to get primary care doctors hip to kidney, to being aware of it, to telling people, to not freaking them out. You're in kidney failure. My oncologist was the first one who said, don't use that term. You are not in failure. That's down the line. I was so grateful for her words and medical curses, there's nothing you can do, was told to me by every single one of the people I saw. Yeah. Until I stopped. So just as my function basically was right at the bottom of stage 3. I was right at that line into stage 4, being told, don't be surprised if you lose 5% a year. And essentially over time, diet changes, sleep changes, exercise changes, all the lifestyle stuff, lots of supplementing because I did nutritional testing and microbiome testing, got up to like in the 50s, felt absolutely different. Then started doing peptides. And now twice, which I'm very grateful. I don't do labs as often as I used to. It was 68 and I have 1 kidney.
Exactly. Amazing. Yeah.
And some of your input is, yes, I can see it even being 70 to even 80s without over pushing it to not doing well. And one of the people I spoke with is a quote functional nephrologist. I said, well, you can stop doing everything now because it's not going to get any better than that. Because I got to 60 and I thought the world just opened. I was like, and then the next time it was 68, and so my message to people is really be optimistic. That's why Renology is about kidney success.
I love it.
And turning vicious cycles into precious cycles.
Love it. And it is, it's something that I know here at Kidney Coach we're very passionate about, and I know you definitely share this with the book that you're writing. We'll definitely let everybody know when it's ready and it's out and those sort of things. I think we both share that kidney disease is reversible. It's not this thing that everybody's told that it's incurable, and you've had your own journey with it. I mean, we've treated over 350,000 people now have gone through our programs. And, I was talking to you not long ago, I've seen people come off dialysis, which I was like, she going to dialysis? okay, we can probably just help the kidneys, but we're going to need, but no, we've had probably half a dozen maybe that we know of, maybe more fully come off dialysis. So I'm like, no, you know what? It's definitely treatable, reversible. And as you say, everyone's an individual and everyone has to, and the times that I see it work is when where people are doing everything. They can't just take the tablets and the bioregulators. They have to do the exercise, the vagal tone, the alkalizing, the diet. It's not a one bullet solution. It's a lifestyle solution. And what a beautiful opportunity if you decide to take it, right?
Exactly. I mean, I chose life.
Yeah,
and
exactly.
And the rest has been lovely. And
Yeah.
so.
And we're so glad you did.
I know, me too. I mean, I had met my husband not that long before I got sick, and so it was like, it's like finding meaning in life. I'm worried that my battery is going to die, so I think I'm going to walk.
That's all right. We're near the end. I often get asked if people want to contact you, Robin, how do people get a hold of you?
Well, I'm working on creating a website just for this.
So I'll until your website is live, Dr. O's, I will, if you're okay with this, put your email in the show notes, because I do sometimes get asked about people wanting to contact you to connect for some advice around kids, especially because you've got firsthand experience with what you've been through. Are there any last words of wisdom that you want to leave our community with when it comes to kidney disease that you want to share?
You said it. Self-love and willingness. I call this being a kidney yogi, not a kidney warrior. It's my life. I'm not fighting. Just but don't listen to the negativity. I mean, no matter, I've seen people be incredibly positive and self-loving and life-loving, and it's a challenge, and we learn to adapt. And adapting means willingness to not do stuff that you used to do.
Yeah.
Because it's now harmful to what you got now. And these are all lessons. It took me time. It's not easy stuff, and it's challenging to be in touch with how it all is without becoming a whiner, and yet still being articulate about how and what your experience. Facebook communities, kidney communities, were incredibly helpful for me at the beginning. And people would say, well, you don't look sick.
Yeah.
It's like, well, I'm sorry, I guess that's a compliment, but a lot of people found they weren't being heard. And so, having a community of people to share with is really an important thing.
Yeah, I think that's.
And having you, I mean, what you're doing is just extraordinary. And to be honest, early on, I found you guys, and I got the book, and I was like, okay, I'm on the right track. I'm not going to listen to this. There's nothing I can do.
Yeah.
So that's where I'm honored to become a team member with you in this regard, because it's basically all I'm doing anymore. Family practice focused on one thing is a real treat.
Well, yeah, you've got lived, breathed experience on it. And so, again, anyone that wants to contact Dr. Rose, I'll put her details below. And it's an honor to have you sharing this journey and your expertise and your articulation, especially this pioneer journey that you've gone down with bioregulators. It's been, it's so good because you are just my reference point for this. I'm like, I don't need to go right down there because Dr. Rose has done it. She's got a book coming out, so I'll wait for that. And I really want to thank you for your introduction to them, and just, I can really, in the groups you put me in, and just we've got this, people don't know, we've got these amazing communities online of peptide doctors, and we discuss this, and we will put sometimes cases for good, beautiful community that Dr. Rose moderates and puts her heart and soul into it. So I'm excited for your book. I thank you for this conversation. We'll have more, and for in your part of knowledge of and then continuing the conversation from Dr. Grimberg about the role that hormones and how it interplays with senescence and Klotho and menopause. We will have you back.
Natural hormones are fantastic. Start early. Don't fear them. Synthetic hormones, don't go there.
Yeah, thank you for saying that. And it cut out there a bit. So for people that missed it, she was talking about bioidentical hormone replacement, which Dr. Grimberg talked about. It is, it got a bad rap there. I totally agree with synthetics, but I think the bioidenticals have been demonized. And I think the latest research coming out is saying, oh, they don't cause the cancers and things that we thought they did, that actually, yeah.
It was all the, synthetic progestins are nasty.
Yeah.
Just starting there, it's like doing natural progesterone early in perimenopause is a lifesaver for so many women.
Yeah. No, thank you.
And I didn't find that much. I couldn't find that much about progesterone and kidney. So if you find anything, let me know.
I think Dr. Grimberg had some stuff on that. I'll ask him. But again, thank you, Dr. Rose, for being part of our community. Remember to hit subscribe and like. That way you'll get notified anytime we put up new content. If you want to know more about what we do, head to www.kidneycoach.com. You'll find us on Instagram and Facebook. And thanks for being part of our community. Dr. Rose, thank you. I'm sorry about the internet connection, but you are a Molokai in the lovely, I know you said before we cut out you're in the middle of Timbuktu. We are a little jealous of your but we appreciate you logging on anyway.
As we say, aloha.
Aloha, everybody, and thank you. Bye.